So I am also very honored to be introducing Dr. Abe Oudshoorn, who is on faculty, an assistant professor with the School of Nursing at Western University. And he's here to share about the work of the Center for Research on Health Equity and Social Inclusion and collaborative approaches to research in community and how that can support community organizing and advocacy in addressing determinants of health.
Well, thank you all, and thanks for allowing me to join from over here in London, Ontario. I'm on the traditional territory of the Anishinaabe, Haudenosaunee, and Lenni Lenape peoples today. In our interests and our journeys and different approaches that we're taking here, I think to achieve the same thing in a lot of ways, which is, how do we transform problematic systems, and how do we as kind of one person find a way to leverage the greatest opportunity to create change. And that's really what I wanted to share with your network today, and give you, again, more just kind of brainstorming around what opportunities might exist for you to be the most effective as you can be over there in BC. And so my journey, again, is similar in a lot of ways to Mariah, the story you were sharing. Lots of common themes, and my background's as a street nurse, so working at a community health center with people experiencing homelessness, which is really awesome work. Just such a privilege to be a part of that, and to really be so in relationship with people in a way that many other nursing settings don't allow for, with that kind of constant support that we were able to provide. And then at the same time, just like deeply existentially frustrated with the whole thing, right? And this, why does this job even exist, and how does this, how have we created such a terrible outcome for folks in such a wealthy nation? And so, like, being kind of both so invigorated and actualized in the work at the same time, so deeply troubled and frustrated. And that was, for me, that's what really drew me back to academia. I had the opportunity as an undergraduate student to work for a professor in a totally different area. She worked in gerontology, and she this is a time when there was no such thing as family caregiving leaves in Canada, and so she worked and she had provided caregiving. She worked doing research with caregivers, and really saw how problematic that was, and that it seemed like a pretty simple thing to her. Is like, why can't we have caregiving leaves as part of people's rights for leaves, and integrated into union contracts and that sort of thing? So she used research as a transformative tool, and now we have caregiving leaves basically across the country, and her work was some of what started that, actually starting in the East Coast. And so that always kind of hung with me, was like, okay, so there's research can be this tool for creating policy change. And so when I was really deeply frustrated with what I was seeing with people experiencing homelessness here in London, and seeing that the change that needed to happen was a systemic change, right? Policy change. I looked to research as a tool to do that. And so what I wanted to talk to you about is what we've created, this Center for Research on Health Equity and Social Inclusion. I'll call it CRESI for short, which is like, a really awkward acronym, but it's better than saying the whole thing. And really what share kind of the journey of creating this, the tool that it's become, and just suggesting that it's one way that your network might be able to achieve some of your outcomes is through this kind of platform of a research center. So the inception of it is really a group of critical scholars across Western University who didn't necessarily have common areas of interest, right? But common experiences of being kind of one-off champions of kind of niche social issues that we were feeling fairly voiceless, fairly powerless, marginalized in academia in a lot of ways. So our type of research doesn't get the kind of funding dollars that bench sciences get. And so really kind of pulling together to say, is there a way that we as critical scholars can kind of connect and strengthen and empower each other? At the same time, what happens is in the community is that in a lot of ways, research is storytelling. Right? So research creates narratives of effectiveness, of the value of different types of work. And social services in our community really lacking that opportunity to tell their stories through research. And so if it's, again, always the bench science, if it's pharmaceutical companies, if it's large corporations through partnership grants that are getting all the dollars, then you have an organization like a emergency shelter being like, hey, we just want to run like an evaluation of the 20 people that we serve, and we can't even get any money to do that. And so at the same time that as critical scholars we were looking for better ways to support each other, the community was like crying out for support in research, in storytelling, in evaluation. And so we connected in a large network then of critical scholars working from disability studies, from Indigenous research, social services, welfare, human welfare, child welfare, social welfare, um, critical race studies, just all over the board in terms of topic areas. Connected and then connected with all the services who do that frontline work across these various topics, and got together to say, okay, what would it look like to create a research center? What would this mean? How would this be a kind of a platform to elevate our work? And I want to express a number of the real opportunities and benefits in this. So the first opportunity in it is that research centers they're like structurally they're nothing. All you have to do is say we're a research center, and then you're a research center. You exist, right? There's no kind of requirement of boards or funds or staff or anything. It's really just like a research lab is just some scientist who says, okay, now it's the Oudshoorn lab. That's all it takes to exist. And so for us, it was a way of kind of various low-resourced academics and organizations can just call this kind of into existence. And what the community collaboration allowed us to do is really set some clear values and priorities in terms of what we wanted to achieve. And really what I would say is the underlying opportunity is as a research center, as a platform for policy activism. And social activism, and really storytelling of social needs and opportunities. And so, we were able to integrate, and you can read in the About Us there, our values around collaborative research, our values around kind of storytelling around the margins, and really kind of those essences of that critical scholarship, and also really that impact for change. And so, the really nice thing that's happened in my perspective is that more often than not now, we have community coming to us with their issues. And so, as a starting scholar a few years back, I was just like, I don't have any projects. I don't know what to do. And then you reach out to people, they don't know who you are, and they're like, yeah, I don't know. We don't want to just give you our data, that kind of thing. We're in a situation now where we're almost overwhelmed, especially during the COVID-19, as all the organizations wanted to really capture the impacts of that on their services, with requests from agencies coming to us saying, hey, we've got a question. We have a program we want to look at, or a challenge we want to overcome. Do you have scholars who can address this issue? So fortunately, we've built a really large network now, over 100 scholars, and then over 300 if you include students, graduate students as well, who we can then put out calls and say, hey, here's this issue, here's the topic. Or if someone's writing a grant, Now, if I'm putting together a grant with, say, for example, a local shelter, looking at journeys of women finding home in the context of Housing First and its the weird administrative requirements of Housing First and how they marginalized women at times. I put that call out to our network, and 8, 9 people say, hey, I want to be a part of that project, and we have a team, at the snap of the fingers to do the work. And so one of the things is it's very simple to create a center, so it's very low cost. The next thing is, in lots of organizations, academic organizations right now are thinking about their requirements to have value to the local community. And so this hasn't always been the story of academia, right? So academia in the traditional ways was creation of a knowledge as an objective, useful, broadly applicable thing. And so it doesn't matter if it helps anyone today, doesn't help if it matters if it helped anyone here. What matters is just create knowledge, put it out into the atmosphere, and hope it's effective. Now organizations much more are being called upon to say, what is your value? So UBC, what is your value to your community? What is your value to the people who live in your community? And so universities are having to think about community engaged research. And so for us, we really had an opportunity where Western said, oh my God, we've got this strategic plan. We got to do community engaged research. How are we going to do it? And we were able to just waltz right in and be like, hey, we're doing it. We will be your community engaged research. Do you want to give us some money so that you can check your box? And so that really was great timing in terms of the needs of university, and it allowed us to receive some great resources to be able to do the work. And so because of that, we do have 2 staff that we've been able to hire full-time. One who does kind of the administrative backbone stuff, like membership websites, meetings, events, that kind of stuff. And then another staff person who's really like a research project coordinator and keeps all of our different engaged activities moving forward and ensuring that we're meeting our requirements as creating knowledge products and that sort of thing. So that's the second thing is really value to the university. And then the third thing, and I kind of alluded to this in terms of community reaching out, is value to the community. And so we've created kind of 2 big events throughout the year that are sort of networking, almost like research speed dating sort of thing, where we host a platform whereby people can come to the afternoon and they can share their questions, their needs, their opportunities, and really brainstorm what's the knowledge that we want to create as a community, what's the change we want to seek, and what are the tools that are going to get us there. And has created this wonderful platform for making connections across the community. And so, now through the center, we have kind of every aspect of social movements engaged through the work. So we have, activists, we have organizers, we have service providers, we have people with lived experience, we have academics, and more we're seeing really the policymakers. So more often now, when we're addressing a particular topic, we'll have the City of London as the service manager being a part of that work, because much of this is under the auspices of the municipal government or a provincial government representative as well. And so really creating this platform that's connecting so many people in terms of creating knowledge for change. So just wanted to use a couple projects as an example of the opportunity of the work. Now, it's growing quite rapidly. So now under the umbrella of Cressy, we have dozens and dozens of projects. I can't keep track of them all anymore, which is fine. I'm just a steering committee member. I don't need to know everything that's going on there. But a couple I wanted to highlight in terms of opportunity. And so one is working with supervised consumption sites. So it was great, Mariah, again, in terms of connections, to hear you talk about harm reduction and really to tell a much more complex story. So the argument in London, as is happening in many places is about just the location of the facility and discussions around crime and intensity and that sort of concern. But obviously, what public health wants to accomplish, and what many in the city are supportive of as well, is more sites throughout the community available at more hours and in different ways, and perhaps serving particular populations to be safe spaces, for example, for women, for Indigenous people, etc. And so we've been doing a narrative based, most of it's focused in photo voice. And so participants are telling their stories through photography that's really engaged a pretty diverse group of people throughout the community, because we have it set up with obviously the participants who are doing the work, but we also have a advisory group who has included the whole mix spectrum of, like I said, service providers, activists, policymakers, etc. And I think really engaging the community in a way more complex dialogue than is traditionally had around this particular topic, and hopefully leading on a real journey to policy impact, funding impacts, all those sorts of things. We're in a situation in Ontario right now where we have a bit of an adverse government, but tentatively adverse. So not as it's not like the Alberta situation, but it's not as positive as other provinces as well. So really, again, using a research study as a platform to really drive what we see as the policy and service direction of a particular service provision. So that's one example. And then another example is work that I'm doing around emergency shelters and transformation around supportive housing environments. And so what we're doing is we're looking at some shelters that have been forced to depopulate, both prior to COVID by a government that's funding emergency shelter less, as well as during COVID due to various concerns around disease transmission and whatnot. And looking at transforming their spaces into permanent housing with supports. And so repurposing traditionally emergency shelter buildings. And again, this is, it's an otherwise very potentially controversial, tense situation where, numbers of shelter beds are very important. Who's providing what shelter services, even in terms of like the perspectives of different organizations and the values they bring. So it's without the research wrapped around it, this could easily become a giant community battle where we actually lose both shelter and housing if we're not careful in it. So it's a way to, again, tell a complex story that engages all the diverse opinions through the platform of a funded research study that CMHC gave us $100,000 to do this research. But we're using it to drive local policymaking and activism. And at the end of the day, hopefully we will have way more supportive housing in our community through this work. So those are just like two examples of projects to make that real to folks. So really, to conclude, what I wanted to suggest is that there may already be, so I don't know the landscape of your communities, there may already be centers that you can connect with, that you can build and grow. But I did want to just kind of put out the plug for different ways to think about what does activism look like. And Mariah, you've given a great example of a community organization and the way that that activism can happen through volunteers and that sort of support. And then research, I would say, is something we don't always think of as this type of tool. But it really is, and it's truly been invigorating, incredible opportunity for London. As a critical researcher based on in a very kind of traditional university, I was doing a little job hunting on the side and see if there was places that maybe I would find a better fit with my values and my work. What I found is that the values are there already in my university, in my community. They're just kind of they were widely distributed before. We've now brought them all together, and been an incredible. I would brag to say a credible asset to our community, and are telling the stories that our important frontline providers and people with lived experience have been really wanting us to tell for so many years. So that's the essence of Cressy and a potential opportunity for yourselves.